Hi folks, John Zajaros here, and today I wanted to talk about sciatica. I've mentioned sciatica several times before, particularly as it relates to herniated and bulging discs and also degenerative disc disease. But today I wanted to talk about the nerves themselves, and I wanted to discuss a little bit more about what I mean by sciatica not being a specific disease or condition, but rather a symptom of a condition. Now, the sciatic nerve is made up of several nerve roots that come together as they leave the spine, and as you can see here in this drawing here, you've got these nerve roots that are exiting, if you remember from the previous video, the foramen, these holes at the side of the vertebral bodies where they come together and they form these openings, these foramen, and these intervertebral foramen house these nerve roots. Now, between the fourth lumbar nerve root and the third sacral nerve root, these nerves come out of the spine and join together to form the widest and the longest nerve in the body, the sciatic nerve. It's kind of like the Nile or the Amazon of the body when it comes to nerves. And it runs from up here at L4 all the way down to S3, and you remember that the sacrum is fused here, but you do have these nerve roots coming out. So at this third sacral nerve, you've got this final little bit of the nerve that comes in and joins to make up the sciatic nerve. Now, the sciatic nerve, as it travels down the back of the leg, actually before it gets there, it travels in front of the piriformis muscle, and you can sometimes get what's called a piriformis syndrome, where you may have a problem with sciatica that's not related to a degenerative disc or a bulging disc, but actually a problem with the piriformis itself, and we will get into that in a subsequent video and article. But as the sciatic nerve travels down the back of the leg, it branches just above the knee at the back of the leg into the peroneal and the tibial nerves, and those travel down into the ankle, the feet, and the toes. So when you get numbness or tingling down into the toes even, there's a good chance that at some point or other along this route you've got a disruption, or you've got some sort of an aggravation occurring. So and I'm using very technical terms there with disruptions and aggravations, but in fact, there's something going on that isn't quite right. Many times you can trace it back all the way up to the nerve root itself, to where it exits the spine, and you can sometimes get to a bulging or a herniated disc, sometimes degenerative disc disease that's blown out, that annulus fibrosis is blown out and created pressure on the nerve root. Or you can run into problems with muscle imbalances, as in the case of the piriformis syndrome, where you're getting aggravation to the sciatic nerve at some point beyond these roots. And so as we're talking about sciatica, and as we're talking about back pain, and we're talking about degenerative disc disease, which again is not a disease, again we must remember that sciatica is not a specific condition, but is a reflection of something going on at some point along this route, the Nile or the Amazon of the body, this very long nerve that runs from the nerve roots at L4 to S3 all the way down into the toes.